Hi, everyone. Welcome to our annual Fall Implementation Science Seminar Series. I'm Dr. Margaret Crane, and I'll be kicking off the seminar today with Dr. Andria Eisman on economic evaluation. Our implementation science core in the Department of Psychiatry and Human Behavior at Brown University has recently rebranded as the Brown Research on Implementation and Dissemination to Guide Evidence Use, or BRIDGE. We all love an acronym, the BRIDGE program. This is our 6th year of implementation science programming, and we're thrilled to be able to bring these seminars to our Providence and Rhode Island community of implementation scientists and practitioners, as well as to those of you who are joining from other states. Welcome. We are grateful for our partnership with the Advanced Rhode Island Clinical and Translational Research, or Advance-CTR, for supporting the technology and logistics and marketing of these seminars. We also want to recognize our partnership with the Brown Alcohol Research Center on HIV, or Brown Arch, for their support of these seminars as well. So today I'm pleased to welcome Dr. Andria Eisman. Dr. Eisman is an assistant professor of community health at Wayne State University. Her research centers on improving adolescent health through the effective implementation of evidence-based drug use prevention interventions in schools. So this includes designing and testing multi-level implementation strategy and assessing their costs and cost effectiveness, as well as leveraging research collaborations and deploying implementation strategies to advance health equity. She's been awarded many NIH awards, including a KO1 and an R34 from NIDA, both of which examine implementation strategies to prevent substance use amongst youth. During this presentation, please put your questions into the Q&A function. We'll save about 10 minutes at the end of the presentation for Q&A. And without further ado, I'm thrilled to start Dr. Eisman's presentation, Cost and Economic Evaluation of Implementation Strategies in Communities, an overview.
Thank you so much for that, Margaret. I'm really excited to be here today to talk about one of my favorite things, and that is cost and economic evaluation in implementation science, with a focus on working with our communities and how this can help advance the field. So I want to take a little time to review what we'll cover in the time that we have today. We'll talk a little bit about the why of cost analysis and economic evaluation and implementation science, with a specific focus on pragmatic cost analysis and community engagement, so why that's important. My focus will also be on costing implementation strategies. We'll go through an implementation science example from a mixed method study that includes both cost analysis and a budget impact analysis. One of our focuses here really is going to be around cost analysis. Why and how do I even get started? Because for any economic evaluation, the purpose of such an endeavor is making the most of limited resources. How can we optimize outcomes while minimizing costs? And this is important to both implementation researchers and practitioners. Often we're deciding between multiple alternatives, whether they be intervention alternatives or implementation strategy alternatives. And this is also really a very first step, a grounding in thinking about return on investment. That is, were our efforts worth the cost? And then, of course, when we think about this in implementation science, why is this important? Resources are limited, undoubtedly, and we have to make choices. So I'd like you all to take a moment just to think about, your implementation projects, whether they be research projects or implementation practice, and really think about how costs or resources have impacted the implementation. It could be many things. And if you could drop it in the chat, it could be insufficient staff time to deploy an implementation strategy. It could be limited funding to support sustainment. It could be ensuring that there are sufficient resources for startup activities. So just drop in a few examples of how costs and resources have impacted, could be positively or negatively, your implementation efforts. Yep. So one thing that came up was this idea of limited funding to support sustainment beyond an NIH grant, workflow challenges. That's for certain. Other things. Yes, that happens a lot. Implementation costs more than expected or takes longer than expected. Yep, cost of tools, various tools that are involved in the implementation efforts, some that are planned and some potentially that are not planned. Any others? I think there are probably few of us measuring. Yes. Measurement is often a big piece that takes time and effort, leadership support, and the extent to which there is leadership support, cost of sustainment. So I hope you all are seeing that, whether this is a primary research interest or not, undoubtedly costs and resources impact implementation. And if I don't do anything else today, I do convince you all that considering costs and resources and planning for even a very basic cost analysis is really important for us in advancing the field. So why economic evaluation and implementation science? Well, historically, we focus on the cost of the intervention, but not necessarily the implementation, including implementation strategies that are required to implement and sustain various programs, practices, and policies. Not surprisingly, costs and resources are a key reason for sustainment failures. And there are several systematic reviews that have come out recently, specifically in the area in which I work, which is school-based health education interventions, that a key reason for their sustainment failure are limited costs and resources. And while recently, when I say recently, in the last several years, there have undoubtedly been more attention to cost and implementation science, there's still a pretty notable lag behind other implementation outcomes and how far we've come in this particular area. One of the things we've identified why it's important is because there are various perspectives to consider in economic evaluation and implementation science. Often in traditional economic evaluation, the focus is the societal perspective, which is an aggregated perspective. And it's not necessarily to say that the societal perspective isn't important, but when we think about practical or pragmatic considerations for communities when engaging in implementation efforts, sometimes the cost and the burden are not equal across various shareholder groups. We still have work to do around methods development and really the idea of being consistent or fairly consistent and having some guidelines across implementation studies for costs and economic evaluation. While some of the traditional economic evaluation tools work exceptionally well, some of them are a little bit difficult, and it's in many ways like a square peg in a round hole. So this area is still very much evolving. But all of these things collectively are really vital for us being able to meet our objective in implementation science, which is bridging the research to practice gap. I do community-based work, and undoubtedly, when working with communities, one of the key questions they're interested in is, what will it cost us? So if we're asking our communities to adopt an intervention or deploy an implementation strategy, and as many of you noted early, sustainment is an issue. So maybe during the study, we have funds, but what happens when the funds are gone? What will it cost us? And the second question might be, was it worth the effort? But we're going to focus on the what will it cost us? So when you consider cost and economic evaluation for your implementation science projects, what comes to mind? Whether this has been a central part of your implementation projects or not. How do you begin? What do you prioritize? What sorts of things come to mind? Parties involved, yes. Who's involved, who's sustaining what costs and what benefits, and sustainability costs. how to differ between the cost of the intervention and the cost of implementation. That's come up a lot in the field of late. Right? Where the funding will come from, both the initial funding and sustainment funding, right? Who makes the decisions? Who are the decision makers? Who are the key players? And how do those decisions impact, providers that maybe are not making decisions, or patients? So there are often lots of potential considerations when we think about costing and implementation science, right? Some things are very hard to cost for. We will talk about that a little bit, because inevitably, really, costing and implementation science is very much both an art and a science, and we need to make decisions undoubtedly about priorities. So cost analysis. Why might cost analysis be important? Well, it's the first step in economic evaluation. If we don't have rigorous cost data, or at least cost data with which we know its limitations, it's going to be very hard for us to conduct a comparative economic evaluation. So to start to get into, what is the return on investment? When we think about cost analysis, it's important to think about the total or actual costs, right? So what is the total of the value of the resources used? And I say that because sometimes, labor, for example, which is often a substantial part of implementation efforts, may be paid or unpaid. So if we always assume that labor, if we have volunteers, that it's unpaid, we will need to ask ourselves, if this is translated to a different setting, right? If we're replicating it to a different setting, will the labor still be unpaid? It's often important to account for those as best we can. And there are other things, of course, facilities, equipment, supplies. It's really about thinking about the resources needed to run a program, whether it's personnel, facilities, materials, supplies, and we're attaching a value or estimating prices for those resources. And so much of this is really about gathering information so that we can estimate a program's cost. And while the overarching objective is simple, it's certainly not easy. And the question that we often are left with is, what does it cost to implement an intervention? And in that case, it's really important that we think both about the intervention and the implementation strategies. So I want to share, and you'll see this QR code, and I have a link there. I've been working recently with the Accords group out in Colorado and some various partners, as well as the Cherish group, which is the Center for Health Economics of Treatment Interventions for Substance Use Disorder, HCD, and HIV, led by Bruce Shackman at Weill Cornell, and I've worked extensively with Sean Murphy. We have all worked together to develop a cross-sector costing guidebook. And to be frank, this really came out of an effort where we saw many of us working in this space, but addressing different implementation science contexts, some prevention, some treatment, some in justice, some in cancer prevention, some in substance use. But what we found looking across all of these sectors is there were more in common. We had more in common than we had different. And so we brought our resources together to think about how can we develop some, initial guidelines for the field in terms of conducting a cost analysis. So what I'm going to share with you today is really in the context of that costing guidebook that just became available. So there is a link and a QR code for that. And please understand that costing guidebook we're on version 1, version 1 being shared, and it's very much in progress. So I'll talk about each of the sections to really get an idea of how do I even start with costing implementation efforts. And so these are the 6 main sections: know your cost, work processes, methods to collect cost data, calculating and reporting, replication, and When do I need additional expertise? Know your costs. When we think about costs, there are really two components. And today we are going to focus on the first one, which is resources that are used during the process of production, delivery, consumption of an intervention or an implementation strategy. The second focuses a little bit more on downstream costs, and we're not going to talk about that as much today, although I do want to mention it because it is important, in particular when we start talking about budget impact analysis. And so when we think about types of costs, Heather Golden colleagues have a paper focused on this. There are a few main types of costs. We're going to focus today primarily on fixed, time-dependent, and variable costs. Cost categories have been characterized in many different ways. One of the reasons I think it can be helpful as implementation scientists to think about types of costs is really, it helps to ensure that we address the different costs involved in our implementation efforts. So for me, it's really less about, am I putting a cost in the right category? It's really about, when I think about fixed costs, what fixed costs might be part of my implementation effort? Or when I think about time-dependent or variable costs, which of these might be a part of my implementation effort? Fixed costs, for example, are costs that are constant across, regardless of the implementation effort. So often think of like startup costs. It could be modifying a protocol, it could be training. So those are some examples of fixed costs. Time-dependent costs are recurring, but over a given time period. It's something that requires continual investment. So it could be costs for space, like rent or continuous training. So time-dependent costs are based on duration. Variable costs are expenses that change in proportion to the extent and scale of the implementation effort. Think of personnel time and implementation facilitation. So it's likely that the more sites you have that utilize practice facilitation or implementation facilitation, the more time that you will need to devote to that. So that would be a variable cost. And downstream costs, as I mentioned very briefly, are future costs or potentially future savings from participating in a specific intervention or implementation effort. So a key question is often, what intervention or what costs do we include? And the field is often talked about distinguishing intervention costs versus implementation costs versus research costs. I would argue that the most important question we need to ask is, what will it take to replicate this effort? There are times when peeling apart, the intervention costs versus the implementation costs, and even sometimes the research costs, while it can be a useful academic exercise, in terms of communities, it's important to really think about this from the framework of, what will it take to replicate this effort? Even for me, sometimes research costs, what maybe I packed away as a sunk cost or a research cost. When we think about the replication in communities, although it may not look exactly the same, there may be a similar activity. So think of recruitment, for example. So, okay, so we're recruiting for a specific research study, but if we're replicating an implementation effort in a community, maybe they're not recruiting for a research study, but they may need to recruit participants to engage in that particular intervention and or deploying the implementation strategy. So when we think about what costs to include, things like the time I might spend on preparing and submitting an IRB application, that would be a research-specific cost that we would not include in a replication effort, versus time spent educating staff or adapting an existing intervention, collecting outcome data, implementation facilitation support. So those are all costs that we would anticipate would be incurred if replicated outside of a research setting. Most of the time, honestly, if I can collect cost data, I do. It can be incredibly burdensome depending on what it is, but if I am able to feasibly collect the cost data, I do. So when we think about costing, in implementation science, we often use micro costing and more specifically, activity-based costing. This is used in implementation science because implementation strategies in particular often center around specific activities across implementation phases. So we're assigning cost to activities in this case versus products or services. Now, that's not to say, there are certain types of implementation strategies that are more technology focused. So that might look a little bit different. But activity-based costing is especially helpful when many of the costs are associated with labor or personnel time. So with micro-costing, what we're doing is we're measuring, valuing, and adding up the costing components. Now, this is different than gross costing, which is used in many other areas of health economics. That's more top-down. So it would be things like diagnosis-related groups, and it's often from a single data source and aggregated. So the second part of this process is mapping work processes. And there are a couple of different ways to do this using activity-based costing. And it's really about identifying key activities across shareholder groups or stakeholder groups and across implementation phases. And we've identified two central ways to do this that can be done alone or in combination. The first is process maps. The second is process frameworks. So process maps can be, especially helpful if there are specific decision points in the implementation process. So it's about mapping out required steps in a process. And there are areas for decision points where there might be potential variation. This example shows a process map across various stakeholder perspectives, but it could also be across implementation phases. And I've often done it both ways, where we've had both the perspectives reflected in the process map and also the implementation phases. Another way to do this is mapping activities using an implementation process framework. And many of you may have heard of the cost of implementing new strategies by Lisa Saldana and colleagues. We can also use similar frameworks like EPIS. And in this process, we're listing the key implementation strategies, activities across implementation phases, and then proceeding with assigning a value or costing those activities. I want to talk a little bit about activity-based costing. We use it a lot in implementation science, but of course, everything has its benefits and drawbacks. A couple of the things that are especially useful with activity-based costing is that it is pragmatic and feasible. It can be a precise method for determining healthcare and program delivery costs. And it can often be done and provide feedback relatively quickly. On the flip side, however, in terms of drawbacks, in particular, activity-based costing can be time-consuming and burdensome. It doesn't necessarily account for either willingness to pay and it does not evaluate outcomes. And also, very importantly, it can vary widely in terms of precision. So the next part of the cost guidebook begins to delve into the activity-based costing a little bit more in terms of how do we collect cost data. And I'm going to spend a little time just reviewing some of our options to collect cost data. The first being direct observation. So this would be things like time and motion. when a member of the research team might watch and record time and resources to complete each activity related to an intervention or an implementation strategy. There are other ways to do this that also that do a little better job conserving time and resources. It could be things like key moment sampling or random moment sampling, but that is one method. Another that's used fairly frequently is time diaries or activity logs. And this is when staff record time and thus resources necessary to deliver a program or an intervention, including the implementation strategy. So it could be time diaries, surveys, and it's really important in this case to have implementers that are both willing and able to complete these diaries on an ongoing basis. So this places a burden on the implementation and the implementers or the implementation sites. Targeted questionnaires is another way to collect time data. Delivery staff, in this case, indicate the resources necessary to implement a program, and they do this instead periodically. The questionnaires can be rolled out prospectively, retrospectively, or at key moments. Key informant interviews are another way, and I have used these. These can be used alone or in combination with each other. I've used key informant interviews in conjunction with time logs or time diaries to help address some of the limitations of time logs and diaries. And so in some ways, that's a way to validate the data and or triangulate the cost data. But key informant interviews are when the research team interviews informants about time and resources necessary for an intervention. I've also used this as part of a developmental piece. So we did an exploratory design where we asked ahead of time, asked some key informants, what are some of the key resource burdens and or time burdens related to an implementation effort, so that we could help ensure precision with those particular activities related to that implementation effort. And then the last would be on-site data approaches. This is when delivery staff use their internal database to capture time spent on intervention activities. And so you may be interested in, when we think about cost data collection options, you may be asking yourself, how do I know which one to use? A few things you might think about in terms of which one to use. The first is, what is known about key influential parameters or activities? So in a study I did that was a cost effectiveness analysis, the ADEPT study by Kilborn and colleagues, our key influential parameter was implementation facilitation. So in the subsequent study, I focused my efforts on precision around the facilitator's time related to implementation facilitation, because that was a key influential parameter. What does that mean? That was a parameter that if above or below a certain value, it changed whether or not a particular implementation effort was cost effective. Implementation strategy specification. So, using Proctor's guidelines, when we go through the various methods of specifying implementation strategies, that can also give us a good indication of what sort of cost data collection might map well onto that specific implementation strategy. Pragmatic considerations. I don't think it's possible to underscore the importance of pragmatic considerations when collecting cost data. I don't know about you all, but there are certain instances where if I was asking my partners to do an activity log every day for months on end, I'm not sure they would be my partners any longer. So we also really need to think about the relative burden on our partners when we're collecting cost data, and really trying to balance that level of precision with burden. If possible, mapping onto data already being collected is ideal. Doug Levy and colleagues very recently, published a paper that was focused on exactly this question, that passive data collection whenever possible, especially in low resource settings, and aligning this with other data collection methods is really preferable in terms of streamlining the burden on our partners. But ultimately, what is the method that gets you the most rigorous data? So if you are opting for a method that is a high level of precision, but also a high level of burden, you may not get the precision that you're looking for. So it's really about a balance. Calculating and reporting. And I'm going to talk about this when we talk about reporting in particular from the perspective of the decision makers and the stakeholders who work with us. When we think about calculating costs, calculating labor costs, a few things to consider. One is the personnel and position or credentials. So that will first give us an idea of what those labor costs look like. And there are benefits and detriments if we have that person's precise salary and benefit, fringe rate, we can use that. But there are also drawbacks to that in terms of, how externally valid is that? How would that replicate somewhere else? Often we'll take the hourly rate plus fringe. The Bureau of Labor Statistics is often cited as a central source for identifying wage data. However, there are other possible sources, and I've used other possible sources because, specific job categories, perhaps I couldn't find them specifically in the BLS data. So then we'll take that rate times the time for each activity and each individual. So if my activity is a planning meeting and I have an administrator, a teacher, a health coordinator, and state agency staff, I would calculate the rate plus time for that planning meeting for each of those participants. So calculating and reporting, it's helpful to have figures and or tables to describe the main findings. Again, particularly for our partners, in a way that will help them make data-informed decisions. It's really also important to note that major factors may change the conclusion. So we'll talk a little bit about sensitivity and scenario analyses as options to share with our partners how some changes in some factors, such as a personnel a level or job category, may change the conclusion. And giving them examples of things that might change. So if it's a administrator doing an activity versus a curriculum lead versus a teacher, the costs of each of those may be different. Considering our partner's perspective. So when we think about costs and burden, but we think about that, whose perspectives are we including? When we're reporting these data, the perspectives that we include will matter. We are placing a value on the perspectives that we are reporting. And presenting these data in a way that can, in collaboration with our partners, so that they can use the data to inform decisions. So I'm going to share an example from a study that was a paper that was just recently accepted for publication in Implementation Science Communications. And so this example is a pilot cluster randomized controlled trial in schools that's focused on a universal drug use prevention intervention. And in this particular study, we examined deploying enhanced rep versus standard implementation and estimated the costs, and in this study, the budget impact analysis, as well as using mixed methods. So when we were deciding the types of costs we were including, we focused on replication. And these costs primarily focused on fixed costs and variable costs, as well as, we're in the process of considering some of the downstream cost savings. We mapped the work by using the EPIS process framework and activity-based costing across multiple partner perspectives. We used activity logs and key informant interviews for cost data collection. We used several sources, including the Bureau of Labor Statistics, as well as the Mackinac Policy Center for calculating the cost, the hourly wage plus benefit rates. And we are currently in the process of reporting it both in academic settings and for our community partners. So our results, this is our base case, which means it's our mean, it's our average that, both across phases and across partner perspectives. So our most expensive phases were the preparation and implementation phases. The least expensive, at least we had a very short sustainment phase. And we also broke the cost down by our various partner perspectives. So the state agency, the implementers, the lead agency, which initially was the university, and then the regional education service agency, which are regional groups that service clusters of schools. We also found that the relative cost burden was different for different shareholders at different times. And what I mean by that is, for example, the state agency, their cost burden was really in the exploration and some in the preparation phases. There was much less in the implementation and sustainment phases. Our RI-CTR partners, it was much heavier in the preparation and the implementation phases. And for the implementers themselves, not surprisingly, it was in the implementation phase. But we wanted to go a little bit beyond just the base case. We also wanted to share, what I had mentioned in terms of uncertainty. What do potential different scenarios look like? So we estimated what we called a best and worst case scenario. But essentially what we did is we took salaries both at the high end and the low end, and to give a range of what the costs might look like. The best case being, a little over $8,000 per school, and the worst case being, or the most expensive being, about $15,000 per school. So when we did our budget impact analysis, we were thinking about the financial impact of replication. So what would this look like if we were to deploy enhanced rep in other school settings? And what we did was we worked with our partners to determine task reallocation. So in that case, the university would not be the lead agency. The state agency and the RISAs would take over much of those activities, but we relied on our partners to help with that allocation. And so we talked about who would be doing what when. And what we estimated was it would be approximately a little over $8,600 per school to replicate this in other settings. And while all of this was really useful information, the qualitative piece was also very telling, because what we found is across these different settings, there was differing priority and resource alignment. So what does that mean? Well, if leadership was not aligned, did not prioritize health particularly, the burden, and often the unanticipated burden, was not sufficiently captured, but was substantial and frequently on the implementer. And that often resulted in significant personal opportunity costs for the teacher. So what I mean by that is, if the leadership in the organization prioritized health, then the teacher was often able to engage with the enhanced rep activities, especially the implementation facilitation, and they found that engaging in those activities actually was feasible, acceptable, and appropriate. When there was not alignment, there was a significant notable burden, increase in burden on the implementer in particular. And as you can imagine, this can have notable downstream impacts when we think about things like teacher turnover and replacing staff. Excuse me. So consistent with other studies, the costs related to the implementation strategy were primarily labor costs. And even in a recent paper that was presented at the Addiction Health Services Research Conference, even startup costs, which we often think of as sunk costs and we don't count them, even those 90% in this study were labor costs. So this was consistent with many other studies. That the costs vary by phase and partner group. And it's important that we provide this information to aid in planning and decision making. However, our qualitative data indicated that the level of alignment and support often had a notable impact on the burden with potential downstream impact that frankly we didn't sufficiently capture in our cost analysis. For this reason, it's really important to consider these multiple perspectives and use mixed methods so we can avoid what's often referred to as wrong pocket syndrome that Todd Wagner talked about in a recent paper, and that is those who accrue the benefits of an implementation effort aren't always those that fund it or those who bear that specific cost. A couple of the other things that we learned, it's really important to be clear about our assumptions around costing. We didn't capture all the costs, and the qualitative data, helped elucidate that. It's clear that it's important that we be clear about the assumptions that we are making in a cost analysis. Schools, like clinics, like other settings, are very heterogeneous, and so we are not able to capture everything. It's very rare that we're able to capture everything and it's in its entirety. And we do need to make decisions about what types of costs we're going to prioritize and how we're going to collect them. The particular study I talked about, we also had some challenges because it was during COVID-19 and there was some notable attrition. However, it's a useful starting point with next steps in cost analysis. And it reinforces this idea that costs are a central reason for implementation and sustainment failures. A few other things I want to mention, after talking about the study and something that's come up in our discussions around the cost guidebook is, when do I need an economist, right? When do I need more help? Barnett and colleagues wrote a paper recently that's, ask the question, can you do my AIM 3? This is a question we're certainly still working through. When do I need an economist? But what I would say is include an economist early and often if you're able to. Similar to statistics, if we don't work collaboratively to collect good cost data, there's no amount of economic analysis afterwards that can, repair data that perhaps is not as robust as we would like it to be. So across phases of trial development is really important. I do not use economists for accounting. I really try to use economists for informing how we proceed with data collection so that we can both, conduct robust cost analysis and economic evaluation. And that really all of this is a collaborative effort. It's a way for us to collaborate on implementation studies. I want to be sure to leave some time for questions, but do want to mention comparative economic evaluation because this is a really important next step. Because economic evaluation is when we start to move to comparing incremental costs and benefits. Often this is versus a standard or usual condition. And in implementation science, we'll often see cost effectiveness analysis or cost utility analysis, as well as cost benefit analysis. But undoubtedly, a robust cost analysis is a key first step. So in summary, there are multiple approaches to collecting cost data, and no one approach is right. However, cost analysis is foundational for intervention, implementation, and sustainment, and can help inform decisions, really important decisions about resource allocation related to implementation. And I would also argue, as we proceed with this, community or partner engagement is vital so that we can ensure that we provide cost information and economic evaluation information that can be useful to our partners' decision making. I'll share several great resources related to economic evaluation. I want to thank co-authors and mentors in this process, and happy to answer any questions.
Thank you so much, Dr. Eisman. What a fabulous presentation and great overview. We have a few questions in the chat. The first one, you sort of touched on this with number 6 about when to bring in an economist, but this person is interested in doing a retrospective cost analysis. So the implementation science study is done, but they'd like to now do an analysis. And so they're wondering if there's any standards of how to retrospectively do cost analyses if that wasn't built into the study design.
Yeah, that's a great question. I have done retrospective, projects before. I'll just say that it's not ideal. If at all possible, I guess I would encourage anyone who's embarking on an implementation study to think prospectively about how to incorporate it alongside a clinical trial. The however is, that isn't always possible. And it really depends on the level of quality data that you have available to you in order to estimate the costs. And that's where, I know I had mentioned during the talk, the idea of assumptions. So I think what it is important is areas perhaps where you have less precision or areas where you have to make estimations that may be less precise. It's really important to be transparent about the types of assumptions you're making around specific costs. Now, it may be that some of those costs are not necessarily influential parameters, so they may not be costs that in previous work has been, demonstrated to be something that could, change significantly how we would interpret our the cost or the cost effectiveness of an implementation effort. But, I think as long as you have good quality data, especially if it's something where you have a database or an electronic health record or something that already has those data, it certainly is possible.
Awesome, thank you. So the next question is about kind of estimating perhaps a range of costs based off of salaries. So this may be based off of a specific region, staff might cost more or less, or also if you have a staff member who, for example, in the study maybe was very senior, but in reality, a more junior person could be implementing or filling that role. How you kind of estimate for a range of salary costs that might be included in actual, implementation efforts beyond a grant or in different areas.
Yeah. No, that's a really important question, and why sensitivity analyses and economic evaluation are so important. Because that's really what sensitivity analyses give us. They give us that really important range. And as you all saw in the, we did what we call the scenario analysis, which is a form of sensitivity analysis where we essentially took the lowest range, the 10th percentile of each position. Like this is the lowest it would cost to embark, based on the data we collected, versus the 90th percentile was the other range that we used, but that was across all staff. Now, it might be in a sensitivity analysis, you might be able to say, okay, for this particular activity, this personnel, we could use, a particular staff position instead of this one. So that might be, another case of a potential scenario analysis where you could estimate what it would cost if a different position, engaged in a particular responsibility or implementation effort.
Awesome. Thank you. That's really helpful. And then the next question, it was kind of answered actually on your last slide. So if you could go back one, was both about, if you have any recommended resources for folks who want to learn more. And then also too, just if you have a favorite strategy to do cost analyses with. So you're, at the beginning, you mentioned a bunch of different ones that can be used, just if you have kind of your own go-to one that you found is the most useful.
Yeah, that's an excellent question. I've used a few different approaches to time, and I'm going to say time tracking because it's really around labor and then, obviously estimating the cost or the value of that time. So time logs I've used frequently. I think and I think they're used really often in implementation science. What we've struggled with is, the right, I don't want to say the right because there is no right, but the best frequency. I think again, in working with communities, it's really important to think about burden and, balancing precision and burden. And, one of my really early implementation studies, I had my partners, the implementers do time logs, but quite frankly, I asked them to do them too often and for too long. And we ended up with poor quality data. So even though, that method, like asking frequently and tracking time, in an ideal scenario is very precise. It actually ended up being less precise because it was too burdensome for my partners to be able to reasonably complete. So I've seen it done, several ways. I would say I probably use activity logs and informant interviews most often, but really that's because it maps on to my partners and their activities most efficiently. And so what I would encourage you to do is with your partners, to try and figure out what would map onto their work processes most efficiently so that you can obtain the, most precise data with the least amount of burden.
I love how the answer to that is actually just that we need to talk to partners before we just decide here's the method we like the most. So the next question is just again about kind of general costing. I think there's a lot of questions about labor. For example, I can think of some organizations that might just have a lot of meetings where there's a lot of thinking with high up people. So then it's a very costly meeting that, they are very cautious to implement a new program. So they're taking a while to kind of decide. But of course, that's a cost that the organization has to bear if they're implementing a new program because that's their process. I'm just curious kind of how you factor in like the different organizational factors about how slow or how many different meetings they may need to have before they implement within your analyses, because that's not necessary for all organizations, but maybe the case.
Yeah, I tend to be more inclusive than not. So I think, there, as I mentioned briefly during the talk, there was an entire session at the Addiction Health Services Research Conference recently that was in, New York City. There was a heavy economic focus, but there was an entire talk on startup costs, which is essentially what you're talking about, right? So when we talk about those early phases, if we're going to use EPIS, we're going to talk about exploration and preparation phases that often are, time consuming and can be expensive. I think we do our partners a disservice if we don't fully account for those types of costs in the process. Those costs, which, as this presenter was talking about it, is really emphasizing that startup costs, those meetings, those gatherings, that planning is a very important part of implementation. And should we underestimate the costs and we try to replicate it somewhere else, we may be, not sufficiently funded or not have sufficient resources in order to adequately engage in an implementation effort. So, we can always do a scenario analysis and say, okay, we had these partners, it was this much, perhaps in replication, we don't need as many meetings or we don't need as much. So this is what the scenario might look like. But I do tend to be more inclusive.
Awesome. That makes a lot of sense. I'm curious about presenting costs back to partners. If, showing how much implementation science costs, it's not free, certainly. And just if, what you found about how to kind of present that or what to do with the data and, how to I don't know, spin it in a favorable way makes sense, or just if it's more just, feasibility wise, we need to account for these costs. So just kind of what you think about when with presenting the costs.
That's really that's a great question. And when we talked a little bit about the reporting piece, I think the first thing is ensuring that we're reporting this in a way that's useful to our partners, right? That when we present the data, whether they be graphs or tables or whatever it is, that we have our academic audience, but we also have our partners, so that we present the data to them in a way that's useful. What I found really interestingly is that often my partners are grateful that we've accounted for their time. It's like the time that they spend engaging. There's often an expectation. Now, again, I'm in the education sector that there's personal opportunity costs are not are often expected. That when we are trying to account for that time, when we think about the total cost, I think that's a way of valuing, just like the perspective that we adopt, there is a value judgment there. So that when we are accounting for our partner's time across these different levels, we're really highlighting the value of their time and what they do related to the implementation effort.
Yeah, absolutely. I like that perspective a lot. All right. So our last question, and again, this is a lot about kind of the ranges of costs and the scenario analyses, sensitivity analyses. Just if you can assess for costs of implementation for the current project, and then also estimating costs in a more idealized way, like if there's a more ideal implementation team than the one that's currently in place, if that's something that you consider in the analyses too.
So I think what occurs to me is that idea of the budget impact analysis that we did, where we met with our partners and we talked about, what partner would assume the, different responsibilities related to each activities in a specific implementation effort. So one of the nice things about going through this process of, mapping it out in activity-based costing and identifying the personnel is that, you have a roadmap, with which to, consider replication. And I think that once we have that roadmap, it can give some flexibility, like, okay, in this initial effort, these were the personnel involved in these specific activities and across these various phases, but we're able to generate a scenario where perhaps other personnel might be involved and what that cost would look like. And that to me is a really potential exciting direction for the field is, how can we start to generate really useful tools for both ourselves and our partners in terms of estimating these potential scenarios, and what would that look like? Because we're still at a point largely where cost and economic evaluation, like when we're estimating costs, it's reactive instead of proactive. And so, as we move through this, as we begin to develop these tools, one really exciting piece to me would be, being able to collaboratively, start to project what that would look like, with different implementation teams and different, and some researchers are already starting to do this, in particular in low resource settings. But that is really a really exciting direction for the field.
Yeah, absolutely. I also love the idea that it makes the research process helpful for our partners. So we are at time for today. I just want to give a huge thanks to you, Dr. Andria Eisman, for the great presentation on cost analysis. So next week on November 7th at 12 p.m. Eastern Time, we have Shobha Ramadan. I think I mispronounced that, so I'm sorry, presenting pragmatic qualitative analyses for implementation science. So we hope to see you next week. And thank you again, Dr. Eisman, for the great presentation.
Thank you.